Welcome to JAMA Plus AI Conversations. I'm Dr. Roy Perlis, Editor-in-Chief of JAMA Plus AI and today's host. And welcome to our guest, Dr. Eleni Linos. Dr. Linos is the Director of the Stanford Center for Digital Health. She's a Professor of Dermatology and Epidemiology at Stanford University and Associate Dean for Research. Dr. Linos is the author of Perspectives on Artificial Intelligence-Generated Responses to Patient Messages, a research letter which recently appeared in JAMA Network Open. Dr. Linos, welcome.
Thank you so much for having me, and thank you so much for highlighting this piece of work.
In your paper, you compared the responses of clinicians and AI to actual patient messages. Can you say a bit more about what you actually looked at?
Of course. First of all, I want to say that we became very interested in looking at actual patient-doctor communication, because really that's where the information on what patients are thinking, feeling, wondering about really is. And so one of the most exciting parts of this work was trying to get a better understanding, not just of how patients perceive how their clinician responds to their questions through the record, the messages we're all familiar with, but also how they feel about the response they get from their doctor, their clinical team, whether it's generated by a real clinician, a real doctor, or AI assisted. Now, the reason this was super interesting is because we know that there have been other studies showing that AI support for responses to patient messages can really increase efficiency of a clinical team. And, our hope is that it can also reduce physician burnout. So there's many potential advantages. The question we really had was, well, how do the patients feel about it? What do the patients want to know? And what is their perspective here?
And so in this study, you have both survey respondents who were looking at the responses, and you have raters, you have clinical raters who are saying how good the responses were. So when you looked all in, what would you say was the punchline? What did you find?
We found that the AI-generated responses were received more positively by patients, that patients were more satisfied with the responses to messages that were generated with the help of AI. And that was surprising because many of us fear and worry about doctors not paying attention to problems or, not being there for us. But the fact that patients themselves were more satisfied with these responses was surprising, but in a good way.
So the models sort of overperformed your expectations.
Yeah, I think so. I think it definitely gives me hope for the future, because I think if we can create a win-win situation where both doctors can get back some of the time that they want for real in-person communication with their patients, for the deep thinking, the medical work that they're so good at, and patients are getting more in-depth, longer, more detailed, more accurate responses to their queries, that's a really unique situation where this type of technology is helping both the patient and the clinical team, increasing efficiency, and no one loses. And so that's the reason this study and many others in this field give me a deep sense of optimism about the potential of Gen AI in healthcare.
So you mentioned length, and one of the things that I thought was interesting that you found was that the patients, the survey respondents, liked the longer responses from the clinicians, but there didn't seem to be a correlation with the length of the AI responses. I was trying to get my mind around that. Do you have a sense of why that might be?
Yeah, I think the bottom line is that many physician responses are very short. And I think that probably relates to the lack of time. I mean, clinicians, physicians, nurses are so pressed in today's busy and constantly more pressured healthcare delivery system to see more patients, to respond to more messages. And really, time is such a precious resource and a limiting factor that doesn't allow them often to write as long and as detailed responses as they would like. And I think that's what we saw in these findings too, that essentially we know that the responses generated by AI tend to be more detailed and longer on average than the responses that clinicians can provide. And that's another advantage. AI assistants don't get tired, and they also don't have the same time limitations that a real human clinician has. And I think patients do prefer, I think this is a signal that they do prefer more in-depth, longer responses to medical questions.
So, what about empathy? Because the challenge in these research letters is they're so short. They're sort of like research haikus, right? Like squeezing everything into 600 words is really hard. One of the things I wanted to hear more about was the empathy part of this study, because I think you did have ratings of sort of how empathic the responses were. Was the AI able to kind of generate sufficiently empathic responses?
Yeah, absolutely. And I think this has been shown since this research letter, since this study across other fields as well. I think empathy is one of the strengths of these models that is constantly improving. And what I think is really interesting, going beyond the scope of this study, is how these tools will role model empathy and teach us real humans, clinicians, and people living in our communities to respond in more empathetic and caring ways. So I'm very curious as a next step about how the generation of doctors who are trained with these very empathetic, caring, large language models responses that don't get frustrated, don't get angry, have infinite patience, what that will mean for the next generation of medical students who will become the next generation of doctors in the way they communicate. And I think about this a lot for my own kids as well, because I think there is, again, the optimistic perspective here is there is a potential for this technology to elevate all of our real life communication as well. But yeah, going back to your original study, the AI drafted messages were rated very highly on empathy.
If I'm a med student or a house officer reading this study and thinking about how I respond to patients or how I'm going to respond to patients, what's the message? Like, what's the take home in terms of how to write those or how to use AI to write those kinds of responses?
I don't want anyone to get into trouble by uploading protected medical information into regular ChatGPT. So just one caveat to say is that these were anonymized and completely de-identified messages. And we use a version of ChatGPT, which is secure and HIPAA compliant. And so just to be very aware of the privacy guardrails we need to be aware of when we're dealing with medical data, especially with patient messages. So for someone who's on the wards, a practicing doctor, I think the first important thing is just understand what resources does your health system have right now? Do you have a secure HIPAA compliant version of one of these models that you can use? The second thing is familiarize yourself with it, use it, learn how to use it. And if you do have access to one of these, again, private, secure models that you can use, I think encouraging doctors to use these tools as much as they can in a way that they can judge can improve not just the messaging to the patient, but their own time efficiency, their own mental health, their own burnout. Because ultimately, my hope is that this technology, as I said earlier, can be a win-win and deliver better care for patients, make patients feel more comfortable, more heard, but also make those frontline doctors, those interns, those busy residents have a little bit more time in order to do the work that they went into this field to do in the first place.
So I feel like this is where I get to say, don't try this at home. It does make me wonder, though, how do you think patients are going to react as increasingly this becomes part of the workflow, that the responses that they get may have incorporated AI in their generation?
Well, I think our world is changing, and many patients, understandably, and I would say very reasonably, are going directly to these tools and asking their questions. And, often patients cannot get appointments with a real doctor for months. I mean, this is not unusual. I'll tell you a brief story. Clinically, I'm a dermatologist, and I had a friend reach out to me and say that she needed a mole checked, and she managed to get an appointment on Friday and was going to see one of my colleagues. And I remember thinking, how did she get an appointment on Friday? That's 2 days away. Assumed there was a cancellation. And then she texts me on Fridays and says, gosh, I'm such an idiot. It's a year from now. And I came a year early. And I remember just laughing out loud, but at the same time wanting to cry because it is unacceptable and ridiculous that the delays, even in Silicon Valley, in the US, in areas that you don't traditionally think of as underserved or under-resourced, the delays in getting specialty care are so long. But you can imagine for any specialty, even for primary care appointments, it's hard to get the care you need when you need it. And these tools are available 24/7 and are actually very good. I mean, we know from much of the work you've published too in your journal how accurate they are, how effective they are. And so I don't think patients will be surprised that some of these responses have been generated with the support of AI. And in a way, I wonder if they will appreciate it. I think it's always good to know what has been human generated and what has had the support of technology. So in a disclosure way, I would personally want to know if something I receive from a doctor, who it was coming from. But I hope many patients find this helpful and are not worried about it.
One of the things that you've mentioned a couple of times is burnout and the potential for this to help in reducing clinician burnout. And the worry that I've heard expressed is if this makes it more efficient to respond to patient messages, is the expectation going to be instead of responding to 20 of them a day, that people have to respond to 100 a day? In other words, are our workflows just going to adjust to increase the volume where the doc is now in the position of just sort of waving through the AI responses rather than being able to take more time and think about them? Is that something we should be worried about, or do you think there's a middle ground?
I think all of these issues are definitely important to think about. And I think the other challenge or concern I've heard is, as AI helps with the easier medical decisions, the easier responses it's not just that the volume will get higher, but will the difficulty get harder? So will real clinicians be dealing with harder and harder medical decisions in addition to more of them? I think this is a really important topic to think about, how we decide as a society who benefits and who gains from these efficiencies. And just keeping at the forefront this idea that, the workers themselves, the doctors, whatever industry you're in, as these industries become more efficient, ensuring that some of that benefit goes back to improve the lives and working conditions of the employees, of the workers. In this case, the doctors are clinicians as well. I don't think we have any set answers on this yet, but I do think it's a very important question we should be keeping at the forefront.
So I think you in your letter make a strong case for using these kinds of tools. I was sort of curious as I was reading, there's a lot of allusion to the different models that you used and different prompts. Were there times that you got responses back from the AI tools that were just so bad or so strange that you couldn't use them in the study, where you had to go back and change your prompts or rearrange things, or were they fairly consistently usable?
Yeah, so in this study, we were able to use all of the responses. Now, as you know, the models change all the time and they're changing continuously. My sense is that they are constantly improving and heading in directions of being more and more useful. So I think had this study been conducted a year ago, that may not have been the case. But as we move forward, most of the responses I see, even to queries, I've asked since this article, are usable. Obviously, the prompt phrasing, the prompt engineering, the prompt really matters. But I would say that as time goes by, these models are simply improving. They're getting better.
That is encouraging to hear. And I guess my last question for you is, where do you go from here as far as this particular study? So where do you go next in terms of understanding how these sorts of tools work and where they fit into our practice?
Well, I think one very interesting next step is, what does this mean for the world? What does this mean for people across the world globally and internationally in terms of both access to direct care through these LLM based models, but also what does it mean for training and improving the education and responses of frontline workers, again, across the world? As I'm sure you think about deeply through your journal and other work, as technology grows, we always want to make sure we are not leaving anyone behind and thinking actively about who these technology improvements are helping and who is not included or may need to be included. And so for me, one of the interesting next steps is, how does this apply to answering medical questions globally? That raises follow-up question, which is relevant again across industries, which is, what languages are available for these types of responses? Right now, our study was English only, but even in the US, we know that there are many people for whom English is not their first language. So how can these models again be developed and be just as accurate and helpful in other languages? What does that mean for people living in other countries and for languages that are not the common top 5 languages spoken? What does it mean for people from countries that have more rare languages? I grew up in Greece, and, Greece is one of these countries where there's, only 10 million people in the whole country. Luckily, most Greeks do also understand English, but there are many other places in the world where we need to think about not just access, but also language. And I think there's many interesting next steps to be done here that relate to this issue of how these models are integrated safely in medical care. Because as clinicians, as doctors, one of our guiding principles is first do no harm. And as much as we want to run forward to deliver exceptional care, empathetic responses, accurate responses, all it takes is one mistake, one medical error to really put the brakes on something like this. And so safety is really, really important, and developing an analogous process of rating the way we would when introducing a new technology, a new medication, of thinking of side effects or complications or the negative effects and measuring those, because there's no doubt in my mind that these models are going to transform healthcare very, very quickly. And it's our role as academics to make sure we have those guidelines in place to be able to measure and ensure that safety of our patients, especially vulnerable patients, is constantly assessed so that we are heading in the right direction. So I'll say I'm optimistic, but do see many, many follow-up studies and guidelines that need to be further developed.
So optimistic but cautious. That sounds about right to me. I'm Dr. Roy Perlis, and I've been speaking with Dr. Eleni Linos from the Stanford Center for Digital Health about AI-generated draft responses to patient messages. You can find a link to the article in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Morrow at the JAMA Network. Thanks for joining us.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.